What is your name?
My name is Aleksín Ortega.
What is your cultural heritage?
I was born in Peru, so I guess I am Peruvian or Hispanic, as some people will call, or also Latino, as a term that is used here in the U.S.
And what part of Maine do you live in?
I currently live in Waterville.
This year's National LatinX AIDS Awareness Day theme is Living with HIV or Not, We're Fighting This Together. What is your response to this theme?
Actually, it's quite catchy. I like it. It's my reaction is it's really inviting to all of us to embrace the idea that HIV is unfortunately with us, and we have to take care of ourselves, and fight it together.
What do you see as some of the cultural barriers to Latin people getting tested or talking about HIV or talking about PrEP or U equals U?
That's a good question. I mean, culturally, probably because there is a little bit of stigma and shame. I think sometimes there is a fear to deal with it. The same would apply to other cultural groups as well. But I think for Latinos, what the family think is very, very important. Mm-hmm. It doesn't matter if the family knows. I mean, the more they know also about the issue, it's better for everybody at the end. And I think perhaps religion plays a more important role in the way family, your parents, see the issue. Not the personal choice of religion, but how the people that you care about, your family or the people that surround you, basically your family members, are going to see this as a punishment for you being a homosexual or gay or queer. That's probably why they don't want to deal with it at all, or at least they don't want to talk about it, and discuss about it.
What do you think we can do to raise awareness among Latinos, Latinas, and Latinx people about PrEP?
We should understand PrEP as a tool, as an extra barrier to and a very effective one to not get infected with HIV. Mm-hmm. And I think one of the best things that we can do is just really talk among ourselves or with each other about the benefits of PrEP. And if we are using it, like myself, I've been using PrEP for the last 6 years or 5 years, I believe, and I can attest to the efficiency of it. I'm lucky that I don't have any side effects, so I'm able to use it in combination with other prophylactics and with a healthy sexual behavior. So I think talking about it, sharing your experiences, and inviting other people to try it, it's a great way to face this.
Why do you think it's important for Latinos, Latinas, and Latinx people to know their HIV status and get tested?
It is your health. Fortunately, science has advanced so well up to this day that being HIV is not anymore a death sentence, but you need to know your status, and you need to be aware of whether you have it or not to be able to fight it. And I think that's one of the first things that we should all do, regardless of your heritage or cultural or your race. As a human being, we should always aim for being healthy and take care of ourselves, especially among Latinos and Latinas and Latinx people. I was reading some statistics, and unfortunately our ethnicity, our group, has reached 26% of all the HIV cases in the U.S. So that's really high. Almost a quarter of all the HIV-positive people in the U.S. are of Latino heritage or Latinx heritage. We should get those numbers down. We can do that by talking to each other, by being aware of all the tools that we have out there to prevent contraction. And if you have it, to live with it in a healthy way. Get tested, really. I mean, don't be afraid of knowing your status. I mean, it's better to know. Science has come so far that even if you are positive, you can live a very healthy life for many, many years. So get tested and know your status.